I'd like to introduce our first panelist today, Dr. Brian Wu. He's a pediatric pulmonologist and Quest Medical Director at HMSA. During this pandemic, he's been part of various COVID-related task forces and work groups in our state. Dr. Wu, please share your thoughts with us.
Since kind of being involved with a lot of different state-related efforts for COVID since March, I've kind of developed a few kind of guiding principles for COVID. And I think this is particularly important when we're talking about the long-term impacts of COVID in children. The first point is kind of really the key. What you learn today, you may need to unlearn tomorrow. You know, COVID is, I think, maybe a year old now since, or not even a year since their first reported cases of this disease in human beings. So a lot of the information that we're getting hasn't gone through its typical vetting process in our scientific community. But the reason why it gets pushed out so quickly is because we're trying to get information out to the public as soon as possible. So there are times where information gets put out, but then it may change later on. A prime example of that is very, very early on, especially in the US, there's, discussions of whether or not you should wear a mask. But now the overwhelming information is that masks are very important in our ability to decrease, spread of this virus. So again, what I speak about today may change in the future. The second part is, we are all trying to do our best to decrease our risks for, getting disease and also the ramifications of this disease with the resources we have. But there's still ways to do it better, and it is all contingent upon all of us to try to do more that we can to help with this spread of this disease and all the ramifications of it. And then the last part is, together, we truly are stronger as we all work together to, get through this, hopefully once in a lifetime, but it may come up again, worldwide pandemic. We know that there's less vaccination occurring in children. We know that there are less well-child visits occurring. We know that dental visits are decreased in children. We know that mental health visits are decreased in children. And the long-term impact on kids because of all this, we can only hypothesize right now because, again, we're still early into this, but it's very concerning. And also impacts of, school. What are the impacts of these kids that are doing remote learning, not having that face-to-face visit? We know that schools are not just for education, but they are a safety net for a lot of things. CWS, one of their top referrers of potential child abuse actually are from educators in the school. They're the ones that observe it. So that's very important. And, just Civil Beach just came out that a Domestic Violence Action Center just reported a 46% increase on domestic violence calls locally. We know that learning disorders are identified early in education. So how do you identify this if they're remotely learning? It's a challenge. Things like autism, about 1 out of 10 folks with autism are first diagnosed in school by school staff. We know that greater than 3 out of 4 children, they participate in sports, clubs, organizations, theater, whatnot. So what are the impacts on physical and social for that? And we know that the disparity, so kids that are already higher risk for having these, impacts, they are at even greater risk with COVID. We know that kids that already have behavioral issues that I know Dr. Guerrero is going to discuss, they're even at greater risk now because of COVID. We know that kids that are low income or minority students, they already have these discrepancies in services and care. They'll be greater impacted by children. So again, we know that households with children, they already report high rates of problems. And again, this is even more so during a pandemic. 50% experience a loss of income. 12% report insufficient food in our country. So really concerning about, how children are being impacted by all of this. So again, we often discuss, what are the things we can do to reduce the effects of the virus, and what are the impacts of the virus, And then we also discussed, well, what are the impacts of all of the things we're doing to reduce the virus spread? But it doesn't have to be a dichotomy. It doesn't have to be one or the other. Well, what we continue to preach, and this is just kind of an acronym that we kind of threw together, is if we as a society, as a community, can reduce our risks, that helps reduce the risk of not just the virus, but helps reduce the risk of all the impacts that we're doing to prevent the virus. But that's all I have. Thank you very much.
Thank you. That was Dr. Wu, pediatric pulmonologist and medical director for Quest HMSA, speaking on the pediatric pulmonary aspects of long COVID. We're discussing COVID today and the effects of COVID after we have our negative test once we've had the disease. Up until now, we've really been looking at how many cases there are, how many people are dying, but we're really only beginning to understand how sick people can remain after they're out of the hospital, after they now have a negative test. Our two other panelists are Dr. Anthony Guerrero, professor and chair of Department of Psychiatry at JABSOM, and Dr. Elizabeth Tam, chair of internal medicine at JABSOM. She's also an adult pulmonologist. Dr. Guerrero, we started out with the pulmonary aspects of COVID in children. What can you tell us about the behavioral and cognitive aspects in children and adolescents with respect to COVID?
So, the first thing I think is always important is to just make sure we're all working together to face the common adversary. I mean, if you just look at the traditional illustrations of the COVID virus, you may not see it as menacing as it really is. I mean, it sometimes looks like a spiky ball or a kid's toy or, even a Pokemon. But, I kind of like these pictures of COVID-19 because it makes it much more explicit that, we're all united against this common adversary. If you see, these scary monster looking features, then it's easy to get the right motivation to smash COVID, as Dr. Wu had, really urged us to do. Okay, so to cut to the chase, after the negative tests come back, after, we might get through the infectious waves of COVID-19, there is very strong evidence that, there are psychological and psychosocial problems from all of the downstream impacts of COVID-19. That's something that we knew from earlier studies in China that experienced the pandemic much earlier than the US did. And, on the right side of the page, these are actually two unrelated articles that I fused together on one slide. After the first wave of morbidity and mortality from COVID-19, there's second waves of, impact when you're catching up with other conditions and when you're also catching up with, interrupted care and chronic conditions. The fourth wave after that is actually, the psychic trauma, the mental illness, and all of the downstream impacts of economic injury and burnout that, we're all likely to face. So, I think it's very appropriate to talk about the psychological and the psychosocial impacts as things to consider in the long term. And also to cut to the chase, I do think that this is something very serious. There's been estimates that, within the next several years, it could be as much as 75,000 extra deaths from alcohol and drug use and suicide, in our country alone. Just because of all the downstream impacts of the pandemic. And, I think it's something that even locally people are being very sensitive to, that, our population is at risk. And as much as we may see, clustering of infections, we may also be seeing, clusterings of mental health distress and, even suicide deaths. So, as Dr. Wu started to describe, the COVID-19 infection has, direct impact on people who may have experienced illness. There may be, adjustment to having the illness. There may be trauma from the illness itself, or the procedures needed to treat the illness. Because of the general illness it may cause, it can cause something called delirium or, acute confusion. And just because it affects different organs of the body, including the blood supply to the brain, it can have other effects on the brain and the behavior. There can also be direct effects to family members caring for a person who's affected by COVID-19. There could be fear and uncertainty. If there's death or other loss, there could be bereavement, and there could be separation from, the quarantine, the isolation, related things. Okay, a complete talk on human psychological development is a little bit beyond the scope of this discussion, but different things will affect you differently at various ages of life. And when you're a kid, you go through these different stages where you have growing cognitive function and a change in your relationship and dependence on other people. And as you become an adult, there's a lot of ways that you derive satisfaction in life, by working, by having relationships, by feeling generative, by feeling useful, by contributing to a legacy. And of all these things, what do you think is the impact of this pandemic? And, I think all of us would agree that at nearly every stage of development, there can be pretty serious disruptions in the things that we're otherwise trying to achieve in life. So, these are just some pictures to remind us, what happens when people are struck with this illness and, when there's death and, hospitalizations related to it. This can take an emotional toll, at people of various ages. We often think of older populations as being vulnerable to the infection itself, but, older people are also very vulnerable to the disruptions that this illness can cause. I mean, when you look at the things that you may normally look forward to later in life, time with grandchildren, time with family, lockdowns and quarantines and, just the need for social distancing can, really affect all of these. Okay, so some of the bottom lines: kids are very dependent on adults for interpreting reality, feeling psychological safety, and having role modeling and how to cope with a stressor. And vulnerable populations are not just vulnerable to the illness itself, but to the psychological impacts of, the social isolation that we have over here. So, in addition to what I discussed, there's all sorts of other, more indirect impacts of this pandemic. When you look at, the fear that people have to live in, whether you caught the infection or not, when you look at the unemployment, the financial stress, the scheduling disruptions, the separations, the social network disruptions, the spiritual community disruptions, the higher rates of domestic violence, just the trauma of seeing things on social media and other forms of communication, the disruptions with usual developmental tasks, dating, long-term commitments, family planning. There can naturally be a lot of psychological impacts, which is why, the fourth wave really was a pretty significant one in the previous graph, and why it continued, way beyond the, the infectious phase itself. So just to show a few more pictures about COVID's social and emotional disruptions. I mean, many people think that working at home is a great thing, that we all look forward to, but it's actually not as easy as it may seem. Having to multitask, having to, take care of your family and do work at the same time. For certain professions, especially, it can sort of lead us to question, our identity and our ability to be useful if, most of what we did in the past is, involving direct interaction with people. And who would have thought that toilet paper would have caused so much distress in our life, which it kind of did a few months ago when there were shortages. So, I'm I'm not planning to give a comprehensive review of, all of the diagnoses in my specialty of psychiatry, but I will say that there are some conditions that can be triggered anew by having COVID-19. There's post-traumatic stress, acute stress, and depending on the way this infection affects the brain, there can be long-term, neurologic and neurocognitive conditions. And if you look at some information that the CDC has provided, there already is a growing rate of different conditions ranging from depression, anxiety, and substance use, and very concerning. I mean, there's a risk here of having seriously considered suicide.
Thank you, Dr. Guerrero. We just heard from Dr. Guerrero, a child and adolescent psychiatrist and chair at the John A. Burns School of Medicine, chair of psychiatry. Previously, we heard from Dr. Wu, pediatric pulmonologist and Quest medical director at HMSA. We're talking about the long COVID, the long-term effects of COVID. If we look at stats, if you look at what's in the New York Times and NPR and information we get from Hawaii.gov, we're looking at how many cases and how many deaths, but we really are only now beginning to realize how long people can remain ill after they have a negative test once they've had COVID. Our next speaker is Dr. Elizabeth Tam. She's professor and chair of medicine at the University of Hawaii John A. Burns School of Medicine and a pulmonary specialist. Dr. Tam, I was thinking last year for the previous Hawaii Book and Music Festival, we were there in the sun, on the grass, under the tent, and we were talking about the effects of vaping on the lungs. And here we are today on Zoom at UH talking about long COVID. Good to see you today.
So I was asked to speak about the long-term effects of COVID-19 infection. And I realized that, we don't really know long-term what's going on. And it so happens that my Department of Medicine faculty is getting ready. They've actually started some of these studies to get ready to study the truly long-term effects. So to get ready to study like very long-term sequelae of a COVID-19 infection, we're pulling together clinical research, education, and health services to try to get things organized so we can begin to compare people within and between different studies. There have been no guidelines about what to do early in the disease course, but we share with each other as much as we can. So in Italy, we learned from them to watch for some of the clotting abnormalities, and we try to bring that into Hawaii. So we're beginning to understand what we're going to look for now is because of cardiovascular. We're going to refer people to the cardiology group and get these kinds of imaging if we can. Echocardiogram and a special test, a cardiac MRI, we call this. In pulmonary, get pulmonary function tests. We might exercise someone and watch how their oxygen levels respond. And then high resolution CT scans will be assessed. Neuropsych will be involved, and GI, rheumatology, and nephrology services. So this is a kind of a comprehensive, it's not really a study because we're actually providing clinical care. But we're trying to line up the questions we're going to ask and the referrals we will seek. We hope, especially at Queen Emma Clinic, we serve the indigent communities of color, which, as you saw from the Queen's admission circle, are disproportionately affected with COVID-19. And then, of course, we want to have improvements. So rehab, occupational therapy, all of those things all of those services have been contacted to get people ready for this post-COVID care clinic. And then in the long run, we hope we can do studies of natural progression, maybe the effects of interventions. So we will look for all these things, but the research component hasn't really been set up yet. We're really focusing on giving comprehensive care and kind of setting the stage for research. And then, of course, education, including community talks like this that we put in the books and the music for this festival. So we've had a couple of patients come through the COVID-19 care clinic, and this is what it's like. The patient registers. Now that means you're also getting demographic data here. So address, the zip code, and whatever comes when you register, you get important demographic data. Vital signs, physical exam, and here it's not only that we're going to emphasize including a very careful neurologic test, and if they suffered a stroke, also do a stroke scale. Now you'll notice that we're actually identifying, different scales. This one is the NIH stroke scale. And, although there are different measures for things, we're kind of setting out at the beginning which scales we're going to use. This PQS4 for anxiety and depression. Well, we're making this COVID questionnaire, but these are really International Physical Activity Questionnaire. They're validated around the world. So we're trying to use instruments of measures that are used by other people. The Beck's Depression Questionnaire, Hamilton Anxiety, the Montreal Cognitive Assessment. So a lot going on in psychiatry and neurology. Frailty Questionnaire. And then during the first visit, hopefully we can do a 6-minute walk test. And all this is we've measured out, we'll see how far people can walk in 6 minutes while reading the oxygen saturation during the test. So usually we're able to fit that in the test. Then we'll have to send them elsewhere to get some of these other ones, the pulmonary function. Now, the thing with pulmonary function tests is that they generate aerosols. And hearing how infection can be spread by aerosols, small, droplets are big and aerosols are smaller, so they stay in the air longer. But because these generate aerosols from the patient, we have to be very careful, and it takes us a while to set it up. We're going to measure the lung volumes and how well, we're actually trying to measure how well oxygen gets into the blood. But we actually, to measure this, we use carbon monoxide because that'll cross into the blood better than oxygen. So we just give a single breath and we see how quickly that carbon monoxide goes into the bloodstream. Echocardiogram, and we would stress the heart a little bit. So with exercise or some kind of agent like dobutamine that will make the heart beat a little faster and harder, just to see if the perfusion to the heart is okay. Then these blood tests will always be included. This is a complete blood count. And we're looking at these particular cells, monocytes and lymphocytes, which tend to increase after a viral infection. We measure blood labs that will show us kidney and liver function. Troponin is the one from the heart, but we're specifying it has to be the 5th generation, the best, the most recent way of measuring troponin. And then these fancy inflammatory markers, some markers that show clotting abnormalities, and then how we're going to measure antibody to the COVID.